Welcome back. You're watching Eagle News America. I'm Alan Pasoyahe. Governor Mike Dewine issues a revised mask order as the state of emergency in Ohio continues. In Perrysburg, Eagle News correspondent Ranny Bayuga reports.
Thank you, Alan. Governor Mike Dewine addressed the state of Ohio yesterday regarding the surging COVID-19 virus cases. And he started it off by briefly stating or talking about the coming vaccine, and then started to describe this COVID situation. Ohio was at 3% positivity rate in September. Today, 11.2. 68 of the 88 counties are now in public emergency level 3. The rest are in public emergency level 2, and only one county in public emergency level 1. This has been the worst it has ever been. In early September, there were less than 10 counties in public emergency level 3. In September, Ohio was seeing 1,000 cases per day. Tuesday, it hit a new high at 6,500, and yesterday at 5,900, today at 7,101. Many suggest that there are more cases due to more testing. While it is true that there are more testing, but the rate of testing is 4 times less than the current COVID cases. In July, Ohio saw highs of 1,100 patients in the hospitals for COVID-19. Last week, 2,000. Yesterday, 3,000. The trend is sharply up. Ohio also saw 240 patients in ICU last month. Yesterday, over 700 COVID patients are in ICU. Deaths are also up and expected to go higher in the coming months based on the number of new cases today. In the first week of October, 86 deaths were recorded. The first week of November, 104 have died. These current stats were highlighted by the governor last night, underlining the seriousness of the issue. Bottom line is that Ohioans must wear masks and practice social distancing. And they must understand that what they do as an individual can and will affect their neighbors, friends, and loved ones. The governor also suggests to cancel or limit private gatherings. And I quote, "We must all help protect those working in the front lines." And he encouraged Ohioans to work for the greater good. These will help keep our schools open and our economy moving. As an initial step, the governor has reissued the mask mandate with 3 extra provisions for retail establishments. Retail establishments are required to have signage placed on their entrances for people to wear their mask. And they must also ensure customers and staff are wearing masks. A new retail compliance unit to look for violators will be created. First offense will be a warning. Second offense, closure of the business for up to 24 hours. Next week, an assessment will be made to decide what to do for restaurants, gyms, and the like. If the trend does not drop, there will be closures. There is also a new social gathering order. Open congregate areas will no longer be permitted to be freely open, and everyone will be required to be seated, socially distanced, and wearing masks unless they are actively consuming food or drinks. He also restated that the limit for gathering is still 10 for public and private gatherings. The governor is working with hospitals. They are asking that Ohio stays in a state of emergency, and he is looking to them to gauge the issues. As COVID-19 cases continue to rise, the hospital's capacity to service patients will become more strained. Today, they are seeing their stock of PPE dwindle, and more patients are admitted, and staffing concerns are also cropping up. Today, Governor Mike Dewine states that he isn't looking to call for a shutdown. It is all Ohioans' best interest to do what they can to stop the trend of COVID-19. Additionally, he introduced the flu dashboard that will show the trend over time. He also stated that he will be setting aside $30 million to assist the state's 113 health departments, and they are to use this money as they see fit to fight COVID-19. Perrysburg, Ohio, Eagle News, Ranny Bayuga. Back to you, Alan.
Ronnie, what is one takeaway that you found interesting from the governor's address?
Well, last night he had a very good talk with the Ohioans here. And one of the things that he stated was, if you didn't know anyone affected by COVID, you will. And I hear this comment a lot from many people where they're saying, well, I don't really know anyone who's been affected by COVID. And some are even saying it's just hearsay that what we're seeing about all these deaths and infections. And that kind of hit home for a lot of people, I would hope. And to me, logically, it's better to be safe than sorry, so people should wear masks. Back to you, Alan.